It's been labelled the gold standard quarantine facility, and when you're here on the outskirts of Darwin, it's not hard to see why. The former workers' village sits about 40 kilometres from the city centre in the quiet rural community of Howard Springs. It's isolated and mostly surrounded by bushland and one adjacent school. It's been used as a quarantine facility since the start of the pandemic, when evacuees from Wuhan were brought here in February last year, and it quickly gained national and international attention for its ideal quarantine setup, with single bed rooms, private verandas, open air separating cabins, and ample space for health staff, security, catering and clinical care. Since late last year, it's been used for the federal government's repatriation program, bringing home Australians stranded overseas, with about 400 arrivals landing at RAAF-based Darwin every year and travelling here on buses. Stringent infection controls were put in place by the specialist Australian Medical Assistance team, who have been managing the overseas arrivals, and the vast majority of positive cases detected have been cared for within the facility in a special hot zone, with a small number of cases requiring specialist treatment transferred to Royal Darwin Hospital. And while the facility is capable of caring for positive cases, the Northern Territory's Health Minister says authorities planned for about 2% of arrivals to test positive, and the flights from India had to be suspended because more than 15% of arrivals had coronavirus. At one point, more than 50 cases inside the facility. The Minister says there's now contingency plans in place to manage another spike in cases, including setting up AUSMAT's emergency hospitals if required, or transferring positive cases interstate. And while workers here prepare to welcome flights from India once again, the AUSMAT staff are also preparing to hand over control of the facility to NT Health, as the Territory Government races to complete its expansion, with plans underway to welcome up to 1,000 weekly arrivals. While there are 3,000 beds here at Howard Springs, many of them require significant upgrades after sitting dormant, with local tradies working on everything from concreting to air conditioning, and the federal government committing $500 million to run the facility until at least the end of the year. Health authorities say the resumption of flights from India won't affect repatriation flights from other countries or plans for the facility's expansion, with Howard Springs set to welcome 600 weekly arrivals from the end of the month.